For joining. I'm Lauren Morris. I'm a technical advisor with HP Plus and lead developer of the YouthCount tool. So we're going to start off today with a poll about the most important issues regarding adolescent girls' reproductive health. Let me start the poll here. So you should see a pop-up in your screen about the issues regarding adolescent reproductive health, options about school dropout, nutritional implications, health risks, earnings for girls who drop out, and birth outcomes for children of adolescent mothers. And I think you should also see the options in the chat. You can type in the chat or you can respond to the poll. And we've got a couple of responses coming in for reduced earnings for girls who drop out of school, poor birth outcomes. Looks like poor birth outcomes for children of adolescent mothers is in the lead. Really, in the YouthCount model, we're trying to consider each of these issues, and we'll talk through the tool in our session today. So the motivation for the youth model is to generate evidence that can be used by youth advocates to influence policymakers in a few different ways, to influence them to invest in youth reproductive health by demonstrating some of the benefits, to examine youth-centric policies to improve health and socioeconomic outcomes for youth, and to understand linkages between youth reproductive health and other sectors, which the tool can help us to explore. What types of questions can the model answer? So this is a policy model, which HP Plus has a long tradition of. It's less about the projections of the model and more about using the model to understand relationships between our policy that we've defined and some of the outcomes for different scenarios that we define. So some of these questions include things like, how can policies toward reproductive health impact school dropout? How can funding adolescent family planning support child nutrition? How can giving girls control over their pregnancies improve their health and the health of their children? And how can staying in school affect future earnings? So we'll use our scenarios to explore these types of questions. The tool is an Excel-based model that looks at a time horizon of 35 years. It focuses on the population of girls from 15 to 19 years old. We did initially hope to include 10 to 14-year-old girls, but a lot of the data for that population was just very sparse. The tool allows for 3 user-defined scenarios to describe adolescent marriage, adolescent family planning use and method mix, and adolescent access to maternity care. And the model provides results on indicators like the number of births and pregnancies among adolescent mothers, maternal and child health and nutrition, school dropout, income, and GDP loss. So now I'm going to switch over to a demo of the tool. All right. Jay, can you let me know if you can see the screen?
I can see it. It's a little small, but I think you're just going for the big picture. So.
Okay. So we'll start out in this screen that just introduces you to the model, and we can click to go to configuration. So we have a database included that has countries in sub-Saharan Africa with the recent DHS, along with a few others that you can select a country. If your country is not included in the database, you can enter the data manually. And in this example, we'll be looking at Guatemala, where we just conducted our pilot application. The base year will be determined by the year in which you have data. So in this case, we're using the Guatemala DHS from 2015, or as it's known in Guatemala, ENSME. You'll see it labeled that way. We also define an intermediate year that corresponds with local policies and goals. And then the end year is 35 years later. Then we name our scenarios. In this case, we have a constant scenario that just projects out into the future as if every year was like 2015. We have a scenario where we increase family planning use, and then a third most ambitious scenario where we increase family planning use and change the method mix to more long-acting contraception. Continuing on to the scenarios, there's a lot going on here, but basically what we're doing is that for each scenario, for both our intermediate year and our final year, we're inputting values for the 1 year age groups for girls between the ages of 15 and 19, because we know there's a lot of differences even within this population between 15-year-old girls and 19-year-old girls. So for each of these scenario and model year combinations, we enter the percentage of girls in each 1 year age group that are married, the percent who are using family planning among married and unmarried girls, and the percent who receive good maternity care among married and unmarried girls. The other part of the scenario is to define the method mix. So for each method for married and unmarried girls in each of our scenarios, and for our intermediate and our final year, we define the method mix. Next, we have a series of parameters that configure the model for our specific country. We have the population forecast for 15 to 19-year-old girls, and then we enter the percent of girls who are sexually active in 1 year age groups. The rest of the parameters are for the entire population of 15 to 19-year-old girls, because there often isn't data to disaggregate this any further. We have fertility parameters such as fertility rates. We have health parameters like infant death rate, low birth weight, some nutritional information. And these are available in the database for the 15 to 19-year-old girls, as well as all mothers for reference and comparison. So in this example, for instance, data wasn't available on the 15 to 19-year-old girls for nutrition, so they pulled in the values for all mothers. There are some parameters regarding abortion, some educational parameters, such as the educational attainment for this population, and then economic parameters about GDP, GDP growth, labor force, and capital stock that are used to calculate some of the socioeconomic indicators. So then we can continue on to look at our results, and there are a few different ways to look at the results. In this configuration, we have indicators available in a graph. So this example is for total births, and you can select your indicator from this drop down here. So we see that in our constant scenario, births are relatively constant, kind of tailing off at the end as our population forecast declines. In our scenario where we increase family planning use, we have a decrease in births to adolescent mothers. And then in our most ambitious scenario where we also change the method mix, we see a further decline in births to adolescent mothers. And then at the bottom of the screen, we can see the numerical values in 5-year increments. We can also look at summary tables where we have each of the indicators in 5-year increments and their cumulative values for each scenario. We can compare the scenarios for each indicator and look at the differences between them. And then we've prepared some summary graphs that might be useful for dropping into advocacy materials, things around the cumulative births to adolescent mothers, the outcomes of pregnancies, maternal and child deaths. We have school attendance and the school status for married and unmarried girls. We have cumulative economic impacts, including the economic losses due to school dropout. So that concludes the demo. Let me switch back over to our PowerPoint slides. Sorry for the delay here. I thought it was going to put them right back for me, but it's taking a minute. Okay. So now we have time for questions, and I'm happy to go back over to the model file if you have questions about the model or our application or how the model is used. Feel free to raise your hand or take yourself off of mute since we're a small group, or type into the chat.
Hey, Lauren, this is Jay. Maybe since we've got a couple of minutes to talk about the experience in Guatemala, because I think your polling question said, what's the key concern? And it was really interesting how bringing youth and reproductive health, nutrition, and sex education champions together, and really looking at this as a multi-sectoral opportunity to strengthen, the evidence base and build links between these different professional communities was quite interesting, I found. So it really is I think of youth as kind of one of these big multi-sectoral topics, and this is a good kind of basis for bringing them together.
Yeah, thanks, Jay. And we were lucky enough to have Jay participate in our advocacy workshop in Guatemala, which we held virtually. Due to some constraints over COVID, we kind of adapted how we would normally do this type of workshop. Usually we would get everybody together for 2 or 3 days to review the parameters, develop scenarios, develop messages. And in this case, we broke things up a little bit differently. So we had some in-person workshops, and we did a lot of things virtually. We had a hybrid workshop where people participated online and in person. Instead of doing the validation in the big workshop, we were able to do some in-person and virtual validation sessions with smaller groups of experts on specific topics, which was actually really great. It allowed us to kind of dive deeper into some of these topics and get some really great feedback. For the workshops themselves, our first workshop was sort of around developing scenarios, reviewing the tool, reviewing results, and we had stakeholders from youth, nutrition, and education. So they validated those scenarios, they reviewed the inputs. The second workshop was more around developing the messages, and we developed messages about nutrition, education, and youth, specifically about avoiding adolescent pregnancy as part of the 1,000-day window for improving nutrition, that comprehensive sexuality education really saves lives for adolescent by avoiding some of these negative health outcomes, and that avoiding adolescent pregnancy helps provide adolescents with opportunities to develop with purpose by staying in school and again avoiding some of these other negative outcomes. Anything you'd like to add to that, Jay?
Thanks, Lauren. Just that, given the emphasis on youth and reproductive health these days, I think this tool is an amazing way to get different stakeholders together and kind of find some common ground so that, again, they get to know each other. There's some good, solid evidence that can reflect whatever the policy scenarios are for the country. And in Guatemala, we didn't link this with a specific advocacy initiative, but rather let the 3 different groups that we were working with roll it into whatever work they were doing. And I remember the people from the education sector were going to be using it, like the next week, because they had a big meeting on comprehensive sexuality education and thought that this would be a great way to, get some attention to the importance of the topic.
Thanks. We have a question in the chat about if Zambia is included. It is in the database. Our criteria for inclusion in the database were recent DHS. I think we define that as within 5 years. We started from sub-Saharan Africa. We've also now included Guatemala, and as a result, we've translated the model into Spanish, so that's also available. And I think we also have Philippines because we did some initial work there as well. Other questions?
Just one thought, seeing that Premila is in, okay, go ahead and answer Premila's question.
Oh, sure. So for the 3 scenarios that we used in the Guatemala application, and this is kind of common for this type of model, what we did was the first scenario is kind of business as usual. It's, extending out our projection of every year looking like the base year. The second scenario, we increased family planning use, and we based that off of some goals from some policy documents that were developed in Guatemala. And then in our third scenario, we not only increased family planning use, but we also changed the method mix towards more effective methods. Back to you, Jay.
I was just going to comment, seeing Premila in here and knowing her experience in Malawi, this type of model might be useful there to be supporting, the youth-friendly health services strategy to make family planning more accessible to young people by, looking at what the policy lays out as its goals. We could also layer in either a nutrition strategy or a Vision 2030 in terms of, goals for youth or education. So I think there are lots of ways to develop scenarios that draw on a multi-sectoral approach. It's not just all family planning. It's a lot more than that.
Premila, I see you have your hand up.
Yes, actually, Jay, you're absolutely right. And Malawi would be a great country because there is a focused effort on keeping girls in school because they're building schools right throughout the country. And there is a concerted effort with Ministry of Education on this. And then, and that's being done using education funds and PEPFAR funds. And the main reason for that was because there was evidence that, the HIV infection rates are much higher amongst 15 to 19-year-olds. So the former ambassador actually advocated for more funding for building schools because, the dropout rate of girls between elementary school or primary school and secondary school was very high. And also there weren't enough schools, so kids had to walk great distances, and they were, vulnerable to sexual violations and other things. And menstrual hygiene was an issue too. So the new schools are taking into consideration the whole issue of distance, as well as having menstrual hygiene facilities so that girls don't drop out for that reason, et cetera, et cetera. So anyway, there's a concerted effort for that. And then The country also has done a lot in terms of scale-up nutrition, the SUN initiative. So that would also be fabulous, and I think that's rolled out nationally. So, and we made huge gains through the SSDI services project, and